welcome to YouTube Live. This is our first video, and the goal today is explain to you more about outcomes, about what you can expect for outcomes and why outcomes are important. So first of all, we get this question often, what is outcome? What does that mean? So outcome really is when you start a therapy, you're at a very specific point of, in our case, you have pain. And as you go through the therapy and you get to the end of therapy, and we'll call that point A to point B, at the end, at point B, what is your outcome? Meaning, how much better are you? And outcome is important because there's a lot of different treatments available for back pain, but the providers that you seek very often for your treatments don't have to publish their outcome. So when you don't have to publish your outcome, very often you don't really know what to expect from that therapy. And one of the big flaws in our medical community is the fact that we don't have to publish outcomes. And by not publishing outcomes, there's really no way to compare apples to apples, meaning if you get this treatment, what can you expect? Or if you get this treatment, what can you expect? So part of my goal and part of my vision is to help patients better understand outcome, but what outcomes are for different types of therapies. And it all comes back to the fact that therapists don't have to publish their outcomes. And because providers and therapists don't have to publish their outcomes, you don't know what to expect. So my goal is to give you some clarity to that, and we're going to give you some clarity to help you make better decisions by laying out the outcomes in ways that are relevant to you, meaning I have sciatica or I have a herniated disc, and what should my expectations be? So we're starting this today as day one and video one, and we're going to do it live, and we're going to do it live every day. And as we do this, again, our goal is to present outcomes to you, for you, so you better understand what to expect. We have 500 case studies that we're going to go over. We're not going to go every single one of them, but we're going to start down that path so you understand how to read case studies and understand what a case study is, but also better understand what outcomes are for other therapies. And we're going to start with doing 65 of our sciatica cases. We treat a lot of back pain, we treat herniated disc, we treat bulging disc, but more importantly, we treat sciatica. And we have a 9-step solution for sciatica that, we have the ability to get you from point A to point B, and very often, as I illustrate here, we can get you to point V and you're feeling a lot better, meaning your outcomes are very, very good. So I'm going to present to you this case study so you understand what it is, but also, again, we're going to be doing more of these in the future so you really understand how to read these. So in this particular case, this is case study number 1. And with case study number 1, it was a 41-year-old female. 41-year-old female, she had back pain and sciatica, again, because we've got this 9-step sciatica solution, and she had the back pain for 5.5 years. Before she came to see us, she had seen other providers. She had seen 4 doctors, and along the way she had an MRI and an X-ray. And she had tried different treatments. Her treatments of choice before she got here was physical therapy, chiropractic, cortisone injections, narcotics, and anti-inflammatories. And this is a pretty typical regimen that patients would go through to eliminate their back problem, in her case her back and her sciatica. But what had happened is she had gone through all these therapies and she was no better. Matter of fact, in some cases she may have been a little bit worse. So when we started her at point A, her back pain and her sciatica was a 9. And her oswestry disability index was a 42. I'll talk a little bit about more of that in a minute. Okay? But she had started at this point right here, had gone through all these programs, so there was a fair amount of suffering. She was getting a little bit discouraged, and she felt like she was at the end of her rope before she came to see us. We sent her for an MRI, and after the MRI, what we found was she had a spondylolisthesis, which is a shifting of the vertebrae. She had a degenerative disc disease. She had a herniated disc, she had a bulging disc, and she had sciatica. Now, these 4 variables, spondylolisthesis, degenerative disc, herniated disc, bulging disc, compromise the sciatic nerve. So in her case, she had a pinching of the sciatic nerve as that nerve exited through her spine. These are some of the more common reasons. So we put her into the program. Again, point A for her was back pain, sciatica, leg pain at a 9, and Oswestry Disability Index at a 42. Now, the Oswestry Disability Index is a 10-question questionnaire, and each question is worth 6 points, 0 to 5. So what we do is we have the patients fill out the questionnaire, and we add up the score. And as we add up the score, it gives you a score between 0 and 100. 0 being the best, 100 being the worst. And it's broken down into 5 different categories. 0 to 20 on your score of your 10 questions is what we call a minimal disability. Now the Oswestry is important because it is the gold standard for evaluating how much progress you make with a therapy. Back to outcomes. We know the way to track outcomes is through pain and Oswestry. In her case, a 42. 20 to 40 is what we call a moderate disability. 40 to 60 is a severe disability. Now, the standards of when a patient needs surgery is not well defined. There's a lot of different rules that surgeons use as when you need surgery, but one of them is when your Oswestry is above a 40. And your Oswestry is above a 40 for more than a year. Now, in this particular case of this patient, we know that she had back pain for 5.5 years. So she had this problem for 5.5 years, and she had tried different therapies. In some cases, very strong narcotics. Didn't help her, okay? She's in this category of severe disability because she is a 42. She is a candidate for surgery. She's a candidate for surgery because she's above a 40. She's got a pinched nerve, which is the sciatica, illustrated by herniated disc, degenerated disc in her lumbar spine, causing that pain down her leg. Okay? Anytime you have a pinched nerve for more than a year, Oswestry above 40, typically a surgical candidate. 60 to 80 means you're crippled. The disability as a result of the pain is such that it's very difficult for you to live a normal lifestyle. Okay? 80 to 100 typically means bedbound. So it's broken down to 5 categories. Patient came in to see us. She was at point A. At point A, she was 9 and a 42. So she was a 9 pain and a 42 Oswestry. Put her through the program, 30 treatments. At the end of those 30 treatments, her back pain and her sciatica was a 0, completely gone. Her Oswestry was at 16. Okay? Our goal is to get you down below a 20. Our goal is to get you as close to a 0 as possible, but we say anything below 20 is kind of the safe zone. So she had a Oswestry Disability Index of 16. So when you talk about outcome, the question is, patient started here, where did the patient end up? But also, where did the patient end up 2 years post-therapy? And we have some more studies about that as well. But in her case, she went from a 9 to a 42, and from a 9 and 42 down to a 0 and a 16. So the outcome of our therapy was to eliminate the pain and get her disability index below a 20. That is outcome. Outcome's important because outcome helps you make better decisions about your treatment. A lot of providers do not have to publish outcomes, so you don't know what the end result of a treatment is. So my goal is to help you understand this, give you a better idea of where you can go through our therapy. What does point B look like? Okay, we know her point B was a 0 pain and a 16 Oswestry Disability Index. Okay, this is how we gauge improvement. This is how we gauge outcome. This is important because for you to make the best decisions, you have to understand what to expect. That is our goal. This is video number 1. We're going to be doing 1 video a day. And we're going to be doing them between 4 o'clock and 6 o'clock, Monday through Friday, Central Time. So we'll be on YouTube Live doing this, so you better understand outcomes. The more you understand this, the better healthcare decisions you can make. That is the key. Solving the back problem. If you don't understand this, what happens is you do all these things and you bounce around from provider to provider like a ping pong ball, never getting better. In some cases, in her particular case, her next therapy, if she didn't come see us, very often is surgery. Not always a good choice for this. That is our goal. Thank you. We'll see you tomorrow.